Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. The Advisory Committee on Immunization Practices, ACIP, which recommends U.S. immunization policy to the Centers for Disease Control and Prevention, recently held two important meetings. During the February 24th and 25th meeting, ACIP reviewed data on vaccines for influenza, hepatitis, pneumococcal disease, shingles, and other diseases. And during the emergency meeting held on February 28th and March 1st, ACIP voted to approve the new Janssen COVID-19 vaccine. Joining me today is NFID Medical Director, Dr. William Schaffner, to help explain the significance of these meetings for healthcare professionals and the public. So, Bill, from a clinician's point of view, what were the most important topics addressed at both of these recent ACIP meetings?
Well, Marla, actually, I think you have touched on them. I think far and away the most important in an immediate sense was the approval of the J&J vaccine. And you know that that vaccine is now being delivered, and the vaccination programs with that vaccine are being rolled out across the country. But they did discuss hepatitis B vaccine for the first time in a long time, and they anticipated some new vaccines being licensed to prevent pneumococcal disease, and they did discuss some safety issues related to the zoster vaccine, the shingles vaccine that we're now using.
Great. So to dig a little deeper, ACIP is considering whether all adults should receive hepatitis B vaccination. Are we likely to see a change in policy anytime soon?
Well, soon is a relative word, but I would think within the next year. For the first time in a long time, the ACIP is thinking about hepatitis B vaccine in a serious way. You know, the recommendations are to vaccinate all children up to the age of 19. That's when in immunization world, you become an adult at age 19. Now, beyond age 19, there's a whole list of risk-based indications for the use of hepatitis B vaccine. You almost have to acquire some risk before you are eligible for vaccination. And it's been thought for some time, because the hepatitis B the hepatitis B rates in this country have plateaued. They're not going down anymore. And indeed, in adult age groups, there's some increase, probably related to the opioid epidemic that we're seeing. In any event, for all those reasons and some others, they're now thinking of recasting the recommendations for adults. Instead of having to remember that big long list of indications, to just make them universal, an extension of what's already the recommendations in childhood. Now, exactly up to what age they will do that, I'm not sure, but that's the thrust of the discussions, and we'll see them ongoing in the next one or two meetings of the ACIP that occur in June and then again in October.
So it sounds like we'll have some fodder for a future program.
Oh, for sure.
Excellent. So moving along then, what do we really need to know about these higher valent pneumococcal conjugate vaccines that are currently in development and testing in various stages?
So currently we have pneumococcal conjugate vaccine 13. It protects against 13 different serotypes of the pneumococcus. The two vaccines that are in the process, getting close to licensure, are a pneumococcal conjugate vaccine, a PCV15, adding 2 more serotypes, and then a PCV20. And those vaccines, how they are to be used, and then could the advent of these vaccines have implications for recasting the recommendations for how these vaccines are used in adult practice, along with polysaccharide pneumococcal vaccine. You know, those recommendations are very complicated, once again, encumbered with all kinds of risk factors depending upon which vaccines are to be used. And the recommendations could be simplified, they would be much easier to implement in practice. So those discussions are ongoing. The vaccines aren't licensed yet, but once they become licensed, it's anticipated actually during this year, I think we'll see a substantial recasting of the recommendations for how pneumococcal vaccine should be used in adults.
Great. So shifting to our favorite topic, flu, to what do you attribute the lower than usual influenza activity for the 2020-2021 season, and what are the implications for next season?
Yeah, Marla, that's an understatement. that influenza season has been low. It's been the lowest in memory. It is. There's almost no influenza out there. It's amazing. There are several suggestions that have been made, postulates. One is that they also had a very low influenza season in the southern hemisphere during our preceding summer. And given that, plus the fact that there were interruptions because of COVID in travel between the southern and the northern hemisphere, we probably had many fewer introductions of the virus into the northern hemisphere. That's number one. Number two, of course, is that we're all wearing masks, social distancing, avoiding groups, working at home. All those things provide a reduced environment for the influenza virus to be transmitted. My personal, however, favorite is that children have been staying home from school. They've been schooled virtually, and they haven't even played together because moms are being cautious about keeping children at home. Children are the great disseminators of the influenza virus in our society. They shed much more virus when they become infected. They infect each other because they're palsies with each other and get together with each other so closely all the time. And then they bring the virus home to their elders, to the neighbors, grandparents, and the like. And they haven't had the opportunity to be disseminators this year. So I think actually, as we anticipate what will happen again this fall, with children back in school and our society opening up, flu, I'll be back. And so we'll really have to rev up everyone's interest in getting vaccinated this fall. And we'll all need to get back into that habit with real assurance.
Excellent point. And I think with that, I think there are a lot of questions around where things stand then on the timing of co-administration of flu and COVID-19 vaccines. Anything you can share on that?
I think that issue is marking time at the moment. Everyone recognizes that we have to have some recommendation about that, but we're not quite there yet. But I'm confident by the time influenza vaccination season shows up, we will have a recommendation from the ACIP on that question.
Great. So tell us a little bit more about this newly authorized Janssen or J&J COVID-19 vaccine.
Well, we're all very excited about it. First of all, because it's yet another vaccine with another manufacturer putting millions of doses out there to be used. The second thing, of course, is that it's a single dose vaccine, one and done. What could be easier? With half the effort, we can immunize twice as many people. So that's wonderful. And of course, it can be managed in conventional refrigerator temperatures, which means it can be more widely distributed to rural areas, pharmacists, and to doctors' offices. We'll be able to bring the vaccine closer to the people, making it more convenient for them to get vaccinated. There is already a controversy about exactly how effective this vaccine is in comparison to the Pfizer and Moderna vaccine. And in short, the entire public health community says they're all in the same ballpark. The important issue is how well do these vaccines prevent hospitalization, intensive care unit admission, and dying, the most severe manifestations. And they're all really quite similar. there's nothing much to choose among them. So get the one that's available to you when it's your turn.
Great advice, as always. Certainly looking forward to seeing more supply. Bill, before we sign off, are there any parting comments or words of advice you want to share?
I'll just repeat what I said about COVID vaccine. We need to vaccinate 80% of the entire adult population in the United States to get so-called community immunity, or what's been called herd immunity, that will really reduce the transmission of COVID, this very, very contagious virus. That means all of us, the early acceptors, and those many people who are still hesitant and a bit concerned and reluctant to come in and get vaccinated. Please, everybody, when it's your turn, roll up your sleeve, get that COVID vaccine. We're all in this together.
Wonderful. Bill, thanks again for your words of wisdom. We greatly appreciate it and look forward to talking again soon on the next episode of the Schaffner Report. Take care.
There's always something new.
Thanks.